Hey everyone, this is Dr. O, and in this video we're going to talk about the autonomic pathways in the middle ear. These pathways are not new to you, we've talked about them in the first half of the course, but here we're going to think about them in relation to the ear. So specifically, we're going to describe the pathways, the target ganglia and tissues of the preganglionic parasympathetics that course through the middle ear. So our first pathway here is that of the parotid gland. So you'll remember back to the good times with Dr. Alsop learning about the parotid gland and the pathway of autonomics. And hopefully by this point, you're starting to kind of have a little bit of second nature with this pathway. But let's talk through it step by step. First off, we want to think about which cranial nerve is involved. And that is the one written out here, the glossopharyngeal nerve. Now, glossopharyngeal nerve will exit the cranial cavity through the jugular foramen, and then it gives off a branch that courses back into the temporal bone. So what is this branch called? That's the tympanic nerve, and it courses through this opening leading to the middle ear, which is called the tympanic canaliculus. Now all of that then leads to this meshwork we have represented here, which is called what now? The tympanic plexus. So here you can follow the parts of glossopharyngeal as they enter into the middle ear and are situated on the promontory of the middle ear. So remember that tympanic plexus is directly on the promontory of the middle ear, and also remember that the promontory, which wall is that on? So that's on the medial wall, and it's a projection of the cochlea. All right, so from the tympanic plexus, we reform another nerve which changes names. What is this called? So here is the lesser petrosal nerve. Now the lesser petrosal nerve will course within the cranial cavity and then exit. And it exits through the same place as V3. And that will be the foraminal valley. And the fibers of the lesser petrosal nerve, which remember now are preganglionic parasympathetic fibers, will reach the ganglion. The ganglion here is the otic ganglion, and that is where the postganglionic neuron synapses with the preganglionic neuron. Now, postganglionic fibers will carry out into a branch of V3 to the parotid gland. What branch is that? So that is the auriculotemporal nerve. So excellent. We got through the whole pathway. Now let's look at it in the kind of ear model we have seen a little bit of. So here again, standing with the tympanic membrane at your back, and this is what you're seeing out front, the medial wall. So here, this is the promontory. There's the stapes with the stapedius and the pyramidal eminence, and the round window below. So entering into the middle ear is this tympanic nerve coming up through the tympanic canaliculus, then forming the tympanic plexus here on the promontory, and then from there, the lesser petrosal nerve. And this will exit the temporal bone but stay in the cranial cavity, coursing then toward the foraminal valley. So here it is again, but with the bones intact. So here's that stapes, there's the promontory here, and this kind of region right here would be where we'd find the tympanic membrane. So we've got a little bit of a further off view here, but we see the nerve entering into the middle ear is tympanic through tympanic canaliculus, then the plexus on the promontory, and then the lesser petrosal nerve. So I want to show you where that lesser petrosal nerve kind of exits out of the temporal bone and heads toward foraminal valley. This is not something that you need to know the feature of the skull, but I just want to kind of give you the visual of this yellow line, which is representative of the lesser petrosal nerve, coming out of a little hiatus in the temporal bone, following a groove in the cranial cavity on the temporal bone over onto sphenoid, where it then exits through foramen ovale. All right, so let's move on to our second pathway. Here, we're going to talk about the submandibular and sublingual glands and the pathway leading to them of parasympathetic fibers. So, sublingual, submandibular glands are innervated by facial nerve, a branch of facial nerve. So here we see facial nerve represented. It kind of makes this S curve. And then we know a large portion of the facial nerve will exit the temporal bone through the stylomastoid foramen. And this is where we see our 5 branches that innervate the muscles of facial expression. But within the middle ear, we see a branch coming off. Now, which branch is related to these glands? That is the chorda tympani. So this is found within the middle ear, and we'll look at its relationships with structures in the middle ear in the next slide. But this will course through that and then out through an opening. What opening is that it takes to get to the infratemporal fossa? So that'll go through the Petrosal fissure, and then it will follow a branch of V3. Which branch is that? The lingual nerve. So these pre-ganglionic parasympathetic fibers follow from the middle ear, follow out into the lingual nerve, and then synapse in this ganglion here, which is the submandibular ganglion. From there, postganglionic fibers can either follow lingual nerve, so they re-enter and follow lingual nerve to the glands, or can directly follow blood vessels. And likely there's a combination of both of these. You can imagine more blood vessels coming off around here as well. Excellent. So let's take a look at these relationships. So first off here, I want to point out malleus and incus. And this is the posterior wall of the middle ear. So what we see coming along that posterior and medial wall is the facial nerve within the facial canal. And then we also see where that comes out through the stylomastoid foramen. Now before it exits completely, it gives off this branch here. And that is the chorda tympani. So we can see its relationship to the malleus and the tympanic membrane, which would be sitting around here, and it also courses close to the incus. Now, this is similar to a video we saw before, but now with transparent bone, so you can follow these nerves a little bit more clearly. So again, we can see foramen rotundum, there's foramen ovale, this is the petrous part of the temporal bone. This here is the internal acoustic meatus with the facial nerve coursing through it and then passing over the cochlea and semicircular canals. Also from the superior view, you can see where the tensor tympani projects from that anterior wall toward the malleus. We also see this nerve. Let's put a pin in that and see what it looks like from the side. So here is the continuation of the facial nerve as it then passes through stylomastoid foramen. And here is where it gives off that branch. The chorda tympani heading to the petrotympanic fissure, where it will then exit to the infratemporal fossa. All right. So let's revisit these structures now in the context of the skull base. So we're going to start with glossopharyngeal nerve in relation to the parotid gland, and then we'll move to the facial nerve in relation to submandibular and sublingual glands. So we know that the glossopharyngeal nerve will exit through the jugular foramen, and then it gives off a branch that re-enters the skull to enter into the temporal bone or the middle ear, and that is the tympanic nerve. And you can see that tiny pinpoint there is the tympanic canaliculus. From there, it'll course through the middle ear, forming the tympanic plexus, and then the lesser petrosal nerve. Now, where will the lesser petrosal nerve exit out of the skull? So it'll exit out of the temporal bone and then exit out of the cranial cavity through the foramen ovale, which we can see there. Now, the facial nerve, the major motor portion of it, will exit through the stylomastoid foramen. You see the mastoid process here, styloid process here, and a small hole between the two. Before that happens, though, it gives off a branch within the middle ear that will course through which opening? Can you find it? That'll be through the petrotympanic fissure. So the chorda tympani coursing through that petrotympanic fissure. All right, so relating it back to the walls again, I hope that this brings together some of what we talked about in the first video with these more detailed videos that add on to it. So the question here is, on which wall of the middle ear is the tympanic plexus located? Is it anterior, lateral, medial, or posterior? So pause and choose an answer. And when you're ready, let's find the tympanic plexus first. It is this well-represented line drawing on PowerPoint of mine, shown here on the promontory. Okay, we'll see that this portion right here is the manubrium of the malleus. So remember that that is lateral wall. Here, with tensor tympani and pharyngotympanic tube, is anterior wall. And then these structures back here, you see the pyramidal eminence, facial canal, and the prominence of the lateral semicircular canal are the posterior wall. So the promontory as well as the oval window are found on the medial wall. So the correct answer here is C, medial. All right, that's everything for this video. I look forward to seeing you in the next one, and as always, let me know if you have any questions at all.